Now 1:01, the meeting will now come to order. The next item for business is the report of the Governor's Office of, Office of Elderly Affairs. The chair recognizes Sherry Crane for the report. Here. Okay. The next item for business is the report of the Governor's Office of Disability Affairs. The chair recognizes Bambi Colasoa for the report.
Hi, everyone.
Hi,
On whatever this color.
Seafoam.
Green. And I was not being a complete fraud when I stood before you guys last meeting and said I would definitely not be in front of this council as the director of the Governor's Office of Disability Affairs. I was very sincere in that, but I am still the director of the. The Landry administration asked if I could stay on, so I agreed to stay on for a short period of time and help with the transition. So it's only been a couple of weeks now, but just trying to learn the people in the new administration and make the contacts that I need to make so we can be better advocates for the disability community. My one non-negotiable in accepting the job was that I can continue to be an authentic advocate for the disability community. And they said that's what they wanted. So I don't know if they really know what that means, but you guys know. So on the report, you can see where we have on the second page is the contacts of all of the former staff of GOTA. Hopefully some of you got to know some of them and they've moved on to some really great things. I just want to make sure that you guys knew how to get in touch with them. And then of course we had our GOTA Awards, which was exceptional event as always at the end of the year. And then next week, so Wednesday, we'll have our an MDAC, which is our Emergency Management Disability and Aging Coalition lunch and learn, which are always great and well attended. It's on Zoom. You can sit. It's a web. That's right. That's right. It's at noon. So that's exactly the point. A couple of things that I just wanted to say. If there are issues that you guys are interested in, pushing forward in this new administration. We're really, trying to take that in and trying to figure out what are those things that we can move forward in this administration. It's a different administration with different priorities, but I think there are some opportunities and we just need to figure out what those opportunities are and trying to move things forward. There's a special session going on right now dealing with redistricting as well as some voting 40 election things like 40 primaries. I'm sorry.
Party election.
Yeah.
Is that a quote?
Yeah, I think that's 40 primary elections. Yeah, I think that is. And then there's going to be another special session on criminal justice. So I think there's opportunities if there are any issues around criminal justice that we think, as we all know, that there are more people with disabilities incarcerated. So there could be potential for opportunities there that maybe we can move something forward. One thing that I do want to say is that first I want to welcome all the new council members. And usually when I was on the council, I was very vocal. Please ask questions. You're asking questions of the state agencies. They aren't offended. They've gone through, they've been asked every question there could be. So that helps move the council along. I would also, one thing that I'm really concerned about for this term, and I've said this previously, is around education. I think that we all should be ready for bills that we've seen pass in the previous administration that specifically exclude kids with disabilities from the vouchers. They're going to author those bills again, and there is no governor now to veto it. Governor Edwards has vetoed it. So I think that we really need to be proactive on education. There's been a long time initiative, probably at least 16 years I can think back, of really some things that I don't think align with what we think are best for kids with disabilities, although Meredith is great. I think it's Meredith. This is just the policies of I think the broader people who are elected and that type of thing. So I think that that's where we need to really be prepared. We might not be able to be as proactive. We need to be prepared to be reactive in that arena and have the capacity within all of our organizations to be able to advocate for that. Also, just want to this responsibility of being on the DD Council is a big responsibility. And I'm gonna try not to start crying, but what you do as council members is really important. It impacts my child, my family, each one of you, many of you, your families, it impacts so many people. So I know that it's a big responsibility that you guys have taken, but really lean on each other, collaborate, build the relationships, everything that you guys do, really it hinges on your relationships with each other, with the state agency people, with legislators. And sometimes those relationships are good, and sometimes you have to be an authentic advocate and really tell people when things aren't right. And it might make people uncomfortable, but if you're being honest, it's the best way to move forward. So be empowered in your position as DD Council members, because those of us who are no longer on the council or not on the council, we're dependent on you guys. So, and we're ready to support you. So thank you. That's all I have.
Just
Are there-
I'd quickly say thanks to Bambi and GOTA over the last 8 years, right? Some amazing stuff that's happened over the time period.
Are there any questions from council members on the report? Is there any public comment? Hearing none, the report requires no action and will be placed on file. The next item of business is the report of Disability Rights of Louisiana. The chair recognizes Tori Roca for the report.
Thank you. I'll be brief, and if you need me to talk louder or slow down, as people often do, please tell me, I won't be offended. So
Well, you can do both.
I will do both. Thank you. I will preemptively try to talk louder and slow down. Okay. Our Client Assistance Program, which is our program that helps people with disabilities who are receiving or applying for services from Louisiana Rehabilitation Services, is currently assisting 18 people. We are assisting them in accessing exams, obtaining computers, linking to job training, looking to job training, accessing college, and getting adaptive work equipment. Those are some of the things we help with that program. Our Community Living Ombudsman program, which program we have advocates advocate for people with developmental disabilities living in ICFDDs during the most recent reporting period. And to be clear on the reporting periods on this, I know somebody's asked in the past, why do you have these reporting periods? It's because I get this information from reports from our department directors that go to our board of directors. So I don't do all this stuff myself, obviously. I just get this from people's reports and try and aggregate it in a way that makes sense. And I'm sort of left whatever period they wanted to report on for our most recent board of directors meeting. So that's why these dates are the way they are. During that period, we received requests for assistance and took action on all of the 60 requests. Some of those requests were for help in assistance with the waiver process, dealing with staffing shortages at ICFDD, things like obtaining clothing and furniture that were needed. Our work incentives planning and assistance program, WIPA, which I probably shouldn't even be discussing in this one because we actually run this in Texas now because of the way the new rubric, the new administration came in and created a new rubric for who gets these programs. Lighthouse actually operates the program we used to operate, and the way things worked out is that we could have bumped the Human Development Center from their program and decided not to, and so instead we went to Texas. So I probably shouldn't even be bothering you with this, but we handled about 238 referrals for assistance. But we used to do the WIPA program in the region of the state that includes New Orleans. Now Lighthouse does that operate in Texas because the administration created, not the state, the federal administration, the public created a new rubric to decide who gets these programs. So that's done in Texas, and probably shouldn't even bother with that. Our supported independent living advocacy program, it's similar to our community living program, only it assists people who are on waivers. And we are currently helping 27 people on waivers, doing things like maintaining appropriate and necessary supports so they can remain in the community on their waivers. We are looking to expand that program as we did, maybe tried to last year, that ran into some problems, but we would like to expand this program throughout the whole state because, as you know, we prefer to have people living in home community-based services, not in facilities. So as hopefully people living in home community-based services grow, we are expanding throughout the state to handle that. We're trying to. Our representative payee program provides oversight to representative payees regarding their services to Social Security beneficiaries and gives them support to understand their roles and responsibilities. We currently have a target of helping about 50 people, or helping 50 cases this year, and we're about halfway through and on track to doing that. Some of our recent successes, we discovered that a rep payee was charging fees that while they were allowed to pay them, they needed approval to charge these fees. They needed approval to charge the fees, and they were charging beneficiaries fees to manage their benefits that they weren't really allowed to in that circumstance. So we picked that up and are making that organization reimburse those fees now that we're charging the beneficiaries they shouldn't have been. Our legal work continues. We took part recently in an investigation into a young man who was living in a group home. He had suffered severe burns, and the hospital later discovered that he had ingested a number of objects, including a small wrench and some screws. We worked with an outside law firm to handle the personal injury suit because our attorneys usually don't do personal injury suits for compensation. So we partnered with an outside firm, and were able to reach a settlement that he and his family were happy with. Special education, we have our caseload of education work right now. One of the recent successes was preventing a student from being expelled because it would be helped to be determined that his behavior was due to his disability. And we are still working on Cooper litigation. This was litigation back in that was filed back in 2014 regarding people who were found not guilty by reason of insanity or incompetent to stand trial. Those folks are not supposed to be housed in jails and prisons. Generally, they're supposed to be moved to Louisiana Elms, Eastern mental health system. There's a delay in moving people to that system. Just the resources are kind of difficult to find right now. So we have been taking part in a working group. Our attorneys, one of our board members, who's also the chair of our PAMI Advisory Council, Mental Health Grant Advisory Council, is taking part in a work group to try and reduce the wait list of people waiting to get into Elms, as currently they're incarcerated in jails and prisons and shouldn't be there. So working on that right now. And, we have also resumed regular visits to Elms to meet with patients, address concerns, and ensure individual rights are protected. That's it.
Thank you, Tori. Are there any questions from council members on the report? I have one.
Sure.
I was just wondering, in for special education with the disabilities and behaviors, were they not doing the manifestation determination meetings?
That I don't know. That could be part of the reason why. Maybe they didn't get their need. I can ask about that if you would like, and find if I can make a note and ask if you like. But I
was just wondering because that's part of to make sure they receive FAPE is to see if the behavior is related. So if they're not doing the meeting.
it's entirely possible they weren't. So I don't know for a fact. I can follow up and check on that if you'd like. But
yes, they need to be doing that.
but no, right now.
They wouldn't have to go that far.
Cool.
Any other questions or comments from the council? Lauren?
I don't know if it was with the disability rights, but I thought we wrote a letter about something with the public schools, and was it hiring people with felonies?
The letter that we sent?
Oh, yes, we did.
Did you hear anything back about that?
That was a great letter,
Ebony helped me.
Mom, I read it in your voice, I swear.
All right. I think Ebony too, because she helped me with a lot of the wording. Yeah. Is there any other public comments? Okay. Hearing none, the report requires no action and be placed on file. The next item of business is the report from Families Helping Families. The chair recognizes James Sprinkle. For his report.
James, I am, so will you recognize me?
Yeah.
First up, before we get started, OAAS, when I got the report, when I was listening to the report, I was a little dismayed to find out that I moved from adult to elderly. Just saying. All right. So anyway, in your package, you have something like this. I don't think yours is in color. It's just, do y'all have it?
Yes.
Okay, and I think that give you an idea of what the format is, this could be very, very brief. The solid line that goes straight across is just to indicate what our target is. The blue line that's wiggly shows the progress we've made in order to be able to document where we are with that, and that's the same for each one of them. The reason I gave you this is because I wanted you to see how we as Region 3 have progressed in our delivery of the targets for DD Council. We have other responsibilities for other funding agencies, but I'm just reporting on the DD Council right now. So if you looked at this, one of the things, this one that's on the screen right there is just number of people trained. We have to have at least 200, 320, yeah, 300. We've gone and we've done much, much more. You see the little dip below the red line, that was the pandemic. We couldn't get, people weren't going to the grocery store, they weren't doing anything, and we didn't really have the technology at the beginning of that year to be able to do the remote training that we're doing now. So that's just an example. You can look at the chart and see the rest of the stuff. But what I wanted you to see is some of the takeaways that you can get from all of these activities. This is the biggest one right here, the outreach activities. DD Council requires us to do 25 a year. We do in excess of 140, 150. They don't all count for DD Council. But the reason I wanted to bring that up is because we go to places other than DD Council requires pediatricians, hospitals, ABA clinics, PT and OT clinics, and schools. Yeah, I remember schools. I used to be one. So that's what they require. But we also go, because that's not the only places where kids with developmental disabilities are identified. We go to physicians, general physicians, we go to orthopedists, we go to all kinds of places. We go to Head Start, we go to early steps meetings. We do all kinds of things that are in excess. And when you see that blue line going up like that as drastically as it did, here's what the results are, the takeaway that I want you to see. Because of that, we've had more contacts. If you look at the first one on your on the sheet, we've had more contact. We went up 2,850 is what we're required. We went up to about almost 3,500 in a year. So look at that. There's a ripple effect. So there's a method to our madness. So it increased the number of trainings that we could do. It also increased the number of people who were trained. So all these things are tied together. And the reason I bring that up to you is because our goal is to be out there more. We want people to know about us. And another activity that we did with the money that y'all gave us, that the legislature provided for us at y'all recommendation, we were able to do a lot of things that helped us. We redid our website to make it more user-friendly. So, and now whatever the website technician did, when you Google disability in Region 3, we were going to come up real quickly. Disabilities in Louisiana, FHF centers come up really a lot more quickly. So we're getting more exposure. Something else we did, we created new brochures. And I gave you each one of these just so you can see. It's just for Region 3. But we had a graphic designer come up with this so we would be able to get this out. And we give this out at every outreach activity that we do, whether it's in a doctor's office, in a community activity, any of those things. But this is a little cumbersome, but this, the little one, you can fit in your pocket. And it was originally designed to be like a cell phone. It came out a little small. It's supposed to be like a cell phone, and we have Google, and it says stop the search. And because you can Google us and you can get this. So and it gives our toll-free phone number. So no matter where you are in the region, it's going to be a free call. So we give these out as well. One more thing that we did is we made, as part of our DD Council contract, we made a poster. that whenever we go to doctor's offices and all, we give this to them. I'm gonna be honest, they're not really eager to put them up yet. But we keep on trying. We're like, did they ever ready money? We're not gonna stop dying. We're not gonna do it. So we do this because then when people go in the doctor's office, they don't know if something's wrong with their child. They don't know, and even if they do, they don't know what to do about it. This at least gives them a phone number. And then when they call us, then we're able to help them by referring them to services in the State Department of Education, in LRS, in all these other places, Disability Rights of Louisiana, Medicaid, a lot of them go to OCDP, a lot of them. But we're able to help them to be able to meet those needs. And that's true of all of our centers. All 10 of our centers is what we do. Now, just to give you a frame of reference, and then I'm done, at least 8 of the directors of the 10 centers have children with disabilities. At least one is a family member of a child with a disability. I'm not sure about the 10th one, but that's one of the requirements that we have, because all of our employees typically have children with disabilities, and it gives us a unique perspective to be able to help and give peer support to people of children with disabilities. We don't know all the answers, but we pretty much know the people who do. So we're a referral agency, and because of y'all's support, we're all able to do what we're supposed to do. And it makes it a lot easier. And hopefully our work, because you make our work easier, our work will make parents' work easier. All of us have been through the system. I was in it before this was ever conceived of. My children they're still adults, but they're closing in on elderly. So they give that. So keep that in mind when we're asking for this money. If it's not made recurring this year, we're not asking because we're pathetic. We're asking because it is so beneficial. We need to be able to maintain this. We need to improve staffing. We're doing this. Our office now has a staff of 4. We used to have 5, but she was recruited by Head Start. So I'm looking for an education liaison, if anybody's familiar and wants to know. But we need to be able to keep this going. And the only way to keep this going is to be able to have some recurring funds that we can utilize for recurring expenses. But we've done a lot with the one-time money that's helped maintain our facility, which you may not say has a direct impact on kids, but I would argue with you that it provides a place for families to come, to get information, to talk to us, to have trainings done. So there's a whole lot of stuff, and we'll keep on doing it. If it's one-time money, we'll keep doing it. But all of us would benefit. And when I say us, I mean the FHF centers, the community, and families with children with disabilities. We all benefit from helping us to do what we can in a more efficient and effective manner. So I thank y'all. If y'all have any questions, I'm more than happy to answer them.
Are there any questions from council members on the report?
And I'm Charlie Michelle, by the way, I'm Executive Director of Violent Families, Helping Families.
Are there any public comment? Yes.
Christy Curtis. I work for My Family Public Family Center in Region 4. And I just want to add to what Charlie said about the posters. I do the outreach. I do community outreach for Early Steps, and I include all of the FHF stuff. But those posters, I'm noticing, I bring them not just to doctor's offices, but hospitals, WIC offices, childcare centers, Head Starts, even SLCC in Lafayette has that poster for Families Helping Families of Acadiana up. So I'm noticing more and more that our posters are going up. So.
And we are going to start going to grocery stores with these things. Continue that so we can press on that, because everybody, whether they have a disability or not, eats.
Yeah. Yes.
I just wanted to suggest maybe if you guys put a QR code that, moms can just scan while they're at the doctor's office, and it'll open up to your website. It's just easier that way, especially on these little cards.
I'm like,
I know how to spell QR code. I'll have to talk to Julie about what it is.
No, you took that Aaron back there?
Yeah.
And I have a question. Charlie, we talked about one time, I was having a conversation with the directors about maybe doing like a table and the rotunda at the Capitol, or just about families helping families, like during the session. Has there been any more discussion about that?
Honestly, I don't even recall the original discussion. So
I think that would help bring exposure, because I think the legislature sees LeCan, but they don't necessarily understand probably that Families Helping Families has LeCan as part of, their staff, but there's a whole, work that they do. So I think that would be a great way, and a lot of organizations do that.
I'll talk to them about that.
Yeah.
Any other public comments? This report requires no action and will be placed on file. The next item for business is the report from the Office of Citizens with Developmental Disabilities. The chair recognizes Julie Foster Hagan for the report.
Ours is on, I guess this is a new ditch color, report, and it's way too long for me to even get through it. So I will highlight just some things, but happy to take questions about anything in the report or anything I say at the end. Mindy talked earlier, you know, in the last quarter, we spent a lot of time working on all of the exceptions and flexibilities with the public health emergency ending. Trying to make sure people had all the information they needed. We still are getting some questions, but all of the PowerPoints, all of the informational sessions and trainings that we did can be found on our OCDD website. We have had some people ask about being able to translate. So our videos, there's a link that you can click on that the closed captioning will be, I think there's 25 or 30 choices of different languages that it can, the closed captioning can be seen in. If you do still have any questions or know folks, again, happy to take them now, or we do have active, we have an OCDD info at LA.gov address. When we get those in, we try to get an answer within at least a couple of days, and then we collect those so that we can do sort of frequently asked questions and answers to be able to get that document out. That is also found on our website, because a lot of people have similar questions. So you guys can find all of that there. The next thing I'll chat about is just incontinence supplies. There was advocacy done last year to be able to add incontinence supplies for adults in our home and community-based waivers. We were able to get that added in the residential options waiver and the new opportunities waiver. Last quarter, we talked about that a little bit, and we still had some hiccups. We're still working through some of those, but hopefully information is out there. For the supports waiver, we do have CMS approval to be able to start offering that for folks in the supports waiver, but we have it's called an administrative rule, and we have to get through that process. We were hoping that administrative rule would go out in January, but it's been delayed, so it won't go out until February. So once we can get that rule out and finalized, then we'll be able to add incontinence supplies for adults who are in our support waiver as well. I've talked in here before about some legislative reports. There's 4 or 5 different reports that we've been in process of working, some collaboratively with Medicaid and other groups. I've gotten some phone calls asking, none of those reports have been finalized and approved yet. They will be within the next couple of months. I'm happy to share those with the council as we get the approval on those. Some of those reports were things around studying the assessment we use for rates in our intermediate care facilities. One of the reports was around using remote support for children who are dependent on trachs. One of them was around payments for our support coordination agencies. Those kind of are the 3 biggies that we worked on together in the office. So I'll make sure to share all those legislative reports once they're finalized. We just another update. I've also talked a lot in here about a START team. The START team is sort of a nationally recognized team who works with states on helping to identify gaps in the system related to children and adults who have intellectual and developmental disabilities and co-occurring behavioral health concerns. They did, I'm starting to see this word more, an environmental scan. So they did a lot of work with hearing from families. They worked with hospitals. They worked with, I think somebody mentioned first responder training earlier. They talked with sheriff's organizations. So they had just a large group that they held individual focus groups with. They asked us for lots and lots of Medicaid data. They are in the process of reviewing all of that information, and we expect to have a report by the end of February. It'll sort of be, this is what we found with our scan, and these are some recommendations that we have for the state moving forward related to those groups. And then we do have currently right now 2 focus groups that we're working on. For those of you who don't know, we try to use focus groups to hear have folks sit down at a table with us and have conversations about different things that we're working on, to have opportunities to kind of everybody hear everybody's perspective. One of them we're looking at is around value-based payments. So the CMS does allow states to provide, to set certain metrics. And when you have providers that are able to meet those metrics, they can then qualify for an extra payment or a value-based payment. We had the first focus group this week. I know there was some questions that we're working through around self-direction. You know, why can't folks in self-direction also be eligible? And it's not that they can't, we just have to work out some of the logistics, because the way that we've seen it set up in other states, it's been open to providers. Haven't seen yet where it's been open to self-direction. We're exploring that and researching it based on kind of some of the feedback that we got during that session. And we'll continue to navigate that. We are planning to use some of those American Rescue Plan Act dollars, at least to do our initial payouts. And we do have some outcome measures, because we don't want to just pay it out. We want to pay out some different areas and then see, did it make a difference? So we're trying to identify what are the metrics we need to identify with the payout of the American Rescue Plan Act. So we can then go ask the legislature, hey, we need this money, and we've shown that it works through the Rescue Plan Act dollars. So that's what our plan is around those value-based payment models. And then we will be, I think next week is our first meeting where we're kind of reestablishing what we call a self-direction advisory council. We sent out something asking for registration. We had a lot of folks apply. What we found though with our focus groups is if we can narrow it down to about 20, 25 people, it's a lot easier to have conversation. So we'll have 2 local governing entity representatives, 4 support coordination representatives. We'll have Acumen and Morning Sun representatives, and we'll have 20 advocate designees, so 2 from each region. We did the registration, so we're looking at trying to make sure we have rural and urban folks with complex needs, medical needs, behavior needs, folks without. A lot of times we talk about that, but then we forget, well, we do have tons of people that are supported who don't really have those complex needs. And then we also kind of looked at the number of hours. So we're trying to make sure we have a diverse group in terms of that. And then again, our first meeting will be next week. The advisory group will be open, so people can listen in, but the advisory panel itself will be the only ones who will have kind of that dialogue. And then we're going to start having quarterly meetings. So that advisory council will help inform us on what are we going to have quarterly meetings on, where everyone in self-direction or anybody who's interested in joining can join, but it'll be directed to topics for people in self-direction. One of the things we found most prominent during the PHE is that there seemed to be sort of a lack of people who are using the self-direction option being able to get information. We, can send out memos or emails through Acumen or Morning Sun, but really a need to make sure that we talk about that. We have quarterly provider meetings that are focused on our providers. So we'll do similar, but with the topics geared specifically to folks in self-direction, so they can hear from the state office kind of what are the major things we're working on, if there's any training that needs to happen or anything we need to be able to take back. So that will get started. Like I said, I think our first advisory council meeting is next week. And then we'll be meeting on the third Wednesday, second Wednesday of the month, I think from 2 to 3. We're setting regularly scheduled meetings every month. That's all I had, but happy to take questions.
I have a question. So the value-based payments, in theory, they're gonna go down to the direct service workers, or is it gonna be just to the providers and they decide how that's gonna?
Yeah, so the value-based payment model, the way that is, it's not really like a rate change or anything. So it would be, it would go to the provider. Now, different providers can choose to do different things with it, but we wouldn't be there. At least I'm not sure, there's none that we've talked about. Now, can we set up if the provider does, like, we can set our own metrics. So could we set up, if you provider give a bonus or give this or do this, then that's something that you could qualify for a value-based payment. That's something we could consider because we haven't set those metrics yet. So we could tie the provider getting more money to them showing us that they've done something for the worker. Does that make sense? That could be something that we.
And then, where would we find, just on your website, the upcoming meetings and
focus
things
group
like that?
meetings? Yeah.
Or the ones that are open, where should we find that?
Do we have that on the website, Erin?
We don't.
We can put it on there. We can put it on.
So
the
what is
website.
it, just the Department of Health?
Oh, Office for Citizens with Developmental Disabilities.
Are you done, Lauren?
Are you done, Lauren?
Yeah.
Okay.
Oh. Julie, thank God you love me.
I do love you.
Okay. And Lauren can be so affectionate, but on
Well, see, on the last meeting, you didn't have any questions. I didn't know what to do with myself.
that hurts. On page that,
Okay.
two things.
Okay.
The services being across the, across 3 waivers with increases, the community. They that does say engagement. And then like, so what are those services and like, why do you have the ratios? And then these bullet points on the next thing, like what is all that? Like, what, can you give more detail? Like, are those stuff, like, what are those for?
Sure. So these are those services. So in our waiver, we have different, I guess, provider types. Like your personal care attendant provider type that's who really does services that you get at home. And then we have, I hate this word, but they're called adult daycare, ADC providers, didn't come from me. So ADC providers are who do our employment services and what we call day program services. So you leave home and you're doing those services somewhere outside of your home. So these services that you see in those bullets are services that, those day habilitation or employment providers can now do, and they can bill for. These new services all have to be done in the community though. So people kind of used to think about somebody has a day program. So I go to the day program. They usually ran from like 9 to 2 or 3. And I mostly just stayed at my day program where there were other people with disabilities. Sometimes folks from the community might have come in. I might have a field trip, they called them. I don't like that word either, but they might have done a field trip. Yeah. So, but they would do that sometimes, which just meant they would go in the community. So now what these services do is,
You have field trips.
no, but I miss going to the zoo. I know, right? Or an outing or a field trip. So, I love this. Anyway, these services can now happen those day program providers can do it. It has to be in the community. Employment or meaningful activities. So, for example, we have a provider agency, an ADC provider agency in Monroe, who doesn't even have a building anymore. They don't have a day program building at all. So people leave home and they go do stuff, but they do it in the community and they do it with other people. And so they've kind of they go to the library sometimes. They have found places that are, kind of let smaller groups go because you don't go in great big huge groups. You do it in smaller groups. So the rate had to be higher for that because it used to be that you could have one staff with 8 people. Well, we want smaller groups, like only 2 to 4, but I need to make that rate higher because I've got to have more staff. And then I'm not billing for 8 people, I'm only billing for 2 to 3. So I needed to have a rate. So the rate increase came with, because we've had these services around for a little bit, but it didn't have the right rate. So I couldn't expect people to actually do it because I wasn't paying them to do it. So now they do that in the community. The Monroe folks, like they just went, I went up there not that long ago. They were planning, they had an LSU agriculture school come in. They were giving them not a lesson, but talking to them about plants. I think they were planning, I can't remember what they were doing. They were going to take that and move it. You said you didn't like the zoo. They were going to move it to the zoo. It was going to grow there. They were going to go there, take care of it. And they were going to then work with the animals at the zoo to be able to use the crops that they had grown. So that wasn't necessarily a job. That's kind of an example of like a community activity. But the community career planning is more, so, pick a place that you might want to have a job. We've been talking about employment earlier. The community career planning kind of lets you start to go there. I think somebody mentioned, they like to work with animals. So can I go to the local shelter and have one person or two people that are interested? And so I have a staff who takes me there and I'm kind of learning about what they do at the shelter, learning about the animals. So you're learning to get to eventually what you want, which is a job working with animals. And so that community career planning. And the next bullet just tells you to do these activities. It can't just be sort of an open-ended thing you do in your plan of care. When you have your plan of care and you're talking about your objectives, you have to have clear-cut objectives to what are you working towards? How are you working towards being more independent? How are you working towards a job? And so those are the things that get tied into your plan of care. Is that clear?
Yeah, it will be when I watch this tomorrow.
Okay.
Any other questions from council members?
I do.
Yes, go ahead.
Julie, can you expand further on the value-based payment model? So I guess the first question is this a Medicare or Medicaid program?
It is available through CMS, or they actually have, there's value-based payments for lots of different things in Medicaid, I know, and I can't speak to those. But it's fairly recent that they've used they've used it with like hospitals and stuff for a long time. They've just started talking about using value-based payments for home and community-based services. So that's something relatively new, but the funding for it, yes, it'll be a match of state funds and federal funds that pay for it. But we did get extra money called the American Rescue Plan Act dollars that we drew down, where the activities we do, we have to show what are you doing to enhance or build home and community-based services. So some things have been one-time things. Sometimes they've been things that we can kind of do and study so we can ask for money longer term. So where this is coming from right now is through the American Rescue Plan Act dollars. In the future, we would then need to ask for state dollars that we get federal match for to be able to do it.
Okay. So this is what I'm familiar with, right? Accountable care organizations. I'm a healthcare CEO, so I have a lot of experience here. So what you're saying is that providers would have to opt into the program. How do the providers know that they have this option to opt in?
Yeah, so where we are right now is we're in the process of setting the metrics. Once we have the metrics identified, we then we normally rule by memo, but there'll be memos, there will be informational sessions that'll be distributed to all of the providers who it would be applicable to, who would then be able to have the information about that this is something that would be available.
So like in a normal accountable care organization, we have measures for like pap smear, mammogram, these are the metrics. And then we go by claims-based data to say, okay, Sally didn't get it. So we send patient navigators to say, okay, however you're going to do that. So I guess operationally, maybe you could use the American Plan Rescue dollars to create some type of patient navigator system where, we are notifying the patient or the patient's caregiver to say, hey, Ari didn't get his 6 month, like once you figure out what the metrics are, like figuring out how to notify the caregiver and then keep track of those metrics. again, that's just how we've done it historically was, use patient navigators to kind of get it done, but you need dollars in order to get it done. And then, working with these agencies to gather claims-based data so that you even understand where to launch the navigator. You see what I'm saying?
Yeah, and we do use claims-based data to some degree, probably not as much as we used to. We have all of that is in the Medicaid system. And so we have a business analytics team of 2 people who regularly kind of pull that and look at that to help us sort of identify where are those gaps. Now, we're not drilling down as extensively as what you just talked about, but we're looking more at service utilization and things like that for our waiver services.
So metrics might be like.
Well, we had our first focus group and that's really what they're kind of honing in on. Honestly, we were ready to roll out before COVID, a whole system that we then figured out was way too complicated for people to actually do. What other states have done is started small and then built up from there. So I'm not sure. Some things we've looked at are training opportunities above and beyond what the regular, what the regular training is that folks are required to do. Before it was all based on claims data that we were going to look at. What services are people using? So in each of our waiver services, we have lots of different services available, other than just in-home services, and nobody uses any. 95% of our claims, 95% of our claims are just in-home services. So we were really wanting to expand and have people start understanding and using more services. So we're going to use our claims-based data to look at our folks now starting to use those other services. That was complicated for people to understand, complicated. It concerned families because they said, oh, well, you're setting the precedent to say that means you want people to have less hours at home. And I'm like, no, that's not what I'm saying. I'm saying that there's all these other services available that are really geared towards employment or being more independent. I'm trying to help people understand that they can use those. So we had some work to do there. Ultimately, that's what I would really like for us to be able to do in our system, is be able to see what are we actually doing to help people be more independent, to help people be more connected to what they need to help people be connected to employment. We don't have great ways to measure that right now. So we have another Rescue Plan Act that is looking at what we call a system modernization that ultimately would help us use some of the Medicaid warehouse data, but some data from our plan of care that would help us look more at outcomes than we're able to do right now. And that's a kind of a separate product line that we are looking to do that. So if we can get that, then we can do what you're saying, which is really tie it better to more relevant outcomes than just things like training. But we have this, we will likely start small. So things that aren't going to unfortunately make a huge difference, but at least start to make a dent.
And these are children and adults that would be in the value-based program.
Speak.
Yes.
So as a provider, sure, Paul, but as a provider, to speak to what you're talking about, for that extra money, I have found it more frequently that we're being asked to look at clients that are in need of not just cooking, cleaning, and groceries and doctor's visit. And I found myself needing to hire CNAs for some of the care that we're looking to provide, which is what you're speaking to, the additional training. And as you know, the CNAs don't make $9 and $10 an hour. And if they're going to be trained to monitor a peg tube or a trach or prompting in medicine, we do require med training, but we can't really give medicine, but we prompt them on how and when it's time. But we have been asked at my place, I currently have 3 different clients that are either trach or take meds, or they're food, tube. These are not traditionally the jobs that I would hire somebody $9 to do. And if you do that, it's dangerous. So I didn't even know there was, any additional payments that we could even look at for this. I've just been doing it out of my pocket and paying them $13 $12, $13, $14 an hour. Which is okay coming out of reimbursement. I'd rather do the care than to not. You know, I told her, I bought the company that my dad started 20 years ago. We're a care company. So what do we do? Our opportunities are to care for people and whatever that looks like. I just had one in my company 2 weeks ago. Then they ended up in a facility because we were not able to hire and train quickly enough for this person's, this young lady's needs. And I found that that's really sad. That she encompassed a whole lot of other things that were going on in just her care. It was touched on a while ago, accusations of abuse. She lost her care because she was fraudulently making accusations of abuse. And it was found out that it wasn't, so she was dropped by her company that had her like 10 years. Then I was placed in a position that I couldn't really train anybody quickly to put them in the house before she would go in a facility. What I find that we do as providers, my company, that we are, I don't know if you're home health or who in here, whatever home health is, but I find that the home health traditionally is not doing what they had done in the past. And that a lot of that is, we're looked at, my company does as a provider to provide some of that care that was traditionally done by home health. And it's somewhere between us and a hospice company now. That's what I find. We're not able to care for them. And thank goodness we're able to call in hospice, work alongside, or we step out and go back in when they do it. But that extra money, I think, is what you're saying, to start small, would allow people like me to train people to go into some of these situations where they need to care.
Yeah, it's not there yet. That's what we're looking at. But like, so.
So if a provider. No, well, if a provider agency hires a CNA, their making is $9 a CNA. Is making $9 an hour.
So we pay a rate of, that equates to $18.50 an hour for every hour work. The only so we just say that they have to make $9 an hour. That's the minimum. We don't have any other requirements. Now, it's not used very often, and it's something that's on my list of things that I need to address, but we do have the ability to bill for something called complex care, which you can feel free to reach out if you don't know what that is. So if folks qualify for that, then I'm going to blank. I think it's $38.88 a day, but there's an extra amount that can get paid for the complex care. There is additional requirements. The person has to have a need for the complex care, and there does have to be additional level training, which a CNA would meet the requirements of that additional training. So the complex care can be billed, the provider can, there's an approval process, but they can request that and be approved. That's for both medical and complex behavioral needs. I've heard from folks that's very difficult to navigate. So the part we have to work on is figuring out why aren't folks using it? What is not working? The council had advocated for money for that. The way we envisioned it happening and we submit to CMS, they didn't approve it to happen that way. So we had to go in and do a lot of, I think it took us 2.5 years to get it approved. And we had to sort of change it. So there are some complications, but there I'm sure is something we could do to make it more efficient, because almost no one's using it. And we envisioned at least 25% of our folks would be able to. So that's something on our radar that we need to look at.
Any other questions from council members? Is there any public comment? Hearing none, the report requires no action. We place on file. If there is no objection to the meeting, we did have a recess scheduled. If y'all would like to go ahead and finish. No one hearing no objections, we'll continue. At this time, we will have public comments. The public comments can be on any area of concern or question. Each person will be recognized by the chair and will have 3 minutes to speak.
I just have one question.
Yeah.
Are we fairly confident that we'll be able to do virtual meetings or hybrid meetings at the April meeting, or we do think that's like a guess?
I'm very confident. Who's the we? No.
Any other comments?
Head to.
You think you'll stop picking on me?
You see my new one could not have at that one up.
Thank you for your comments, questions, and concerns. At this time, we will have announcements. The chair recognizes Ebony Hayden.
So I know Lauren brought up the Able account earlier. The DD Council has 2 spots on Able. Two previous chairs ago, that chair sat on Able, and we had another parent advocate who sat on Able. Those people have both rolled off the council, so if anybody is willing to sit on Able or you're interested, we have 2 seats that are available. I'm not sure if they meet virtually. I know their meetings aren't held in Baton Rouge. Kelly, with the Arc of Louisiana, was gonna give me more information about their meetings, where they're held, and then how often. But if you guys are interested, if anybody's interested, just let me know and I'll give her those names. I need to.
Do you want me, I sit on that council as well, or whatever it's called. They don't meet regularly.
Okay.
So it's kind of sporadic when they need to meet, but they're at that Galvez building downtown. I mean, so far, they haven't met virtually, but I think they're in the same situation as you under the Department of Health, waiting to complicate the book.
And then other than that, are you interested?
I'm interested, yeah. I don't know if I can do it, but just, because I don't really know what the commitments are.
Yeah.
Not much.
No, it's not.
It's not. I'm on it too. If you're on it, yeah, it's like
I think when they have
30
changes,
minutes, right?
Yeah, I'm just, yeah.
That's not a lot.
So I'll put your name down, and if anybody else is interested, just let me know.
Now, do they have to be on this council?
Yes.
Okay.
You said you wanted a parent, or did it have to be a specific person? I can volunteer if you want, yeah.
Intentionally, you would probably be a good resource.
Yeah, I'm downtown.
The Medicaid.
And then the other announcement is our April meeting. April meeting is April 17th and 18th. And we'll send out correspondence and it's closer.
Thank you, Ebony. Is there any further business? Hearing none, if there is no objection, we will adjourn the meeting. The meeting is now adjourned. It is